It's my pleasure to welcome you to the School of Public Health and to our special orientation event for the public's health. This event grew out of discussions between several students and alums several years ago about developing an event for all incoming students to introduce you to the school and to your classmates, and as a way to create a sense of community. An orientation event like this one is unique among schools of public health and programs of public health. Our School of Public Health event was also inspired by the white coat ceremony that's held in medical schools across the country for incoming medical students. We want our own public health induction ceremony to be clearly tied to the values to which we all aspire as public health professionals, whether in academia, practice, or other setting. Those values in the internal ethic of public health set us apart from medical schools and other health professions. Since 2020, can believe that, this event has been held virtually, and we are elated to bring this event back to Vulcan for the first time since then. I've mentioned before that when I was a medical student here a lifetime ago, Vulcan's torch was not the spear that you see in his hand now, but it was a light. It usually shone green, unless there was a traffic fatality. You remember that, Dr. Waterbore? Unless there was a traffic fatality that day somewhere in the city. And so this actually, in which case it was red. So this actually had a way of connecting us across the city. We each bore some part of someone's loss. That connection today for me is the promise of a magic city that serves as a welcoming beacon for all. Because we're all forged in ways that are both common and unique, but we comprise one community, one public health community, and tonight we celebrate this community in welcoming our newest members, our new students. We are joined this afternoon by department chairs, associate deans, faculty, staff, and alumni, both here and virtually. Without this community of scholars, there would be no School of Public Health and no inquiry into the health and well-being of our citizens. We are in their debt, your debt, for the myriad of daily contributions that they make. For the Public's Health is our opportunity to introduce you to public health as a community of scholars and professionals dedicated to improving the health and well-being of everyone through education, research, and service. As a class, you are about to embark on a journey unlike any educational experience on this campus. Your classmates are the most diverse at UAB. You will have the opportunity to learn from each other as you explore the complexities of healthy people, from their genetics to their neighborhoods. Your classroom will become a shared experience with fellow students who come from a broad range of social and cultural backgrounds that will enrich, inform, and guide your studies. You will have the opportunity to grapple with the most complex problems facing our communities, from those we live in to those across the globe. The COVID pandemic has been all about the public's health. It is a time like no other, where you can immediately apply what you have learned in the classroom to the greatest public health crisis that any of us have ever faced. It is now my honor to introduce our speaker this afternoon, Mr. George Salem. As a healthcare professional, George Salem has devoted over 44 years to identifying and resolving problems in the healthcare sector. He has never lost sight of making healthcare services accessible and affordable to those in need. During his tenure working with Premier Health from Dayton, Ohio, and Methodist Hospitals of Memphis, he held key positions with a variety of responsibilities. Within those responsibilities in each organization, he successfully led efforts to construct, develop, and operate subsidiary organizations designed to serve underprivileged individuals in lower socioeconomic settings which proved to have a meaningful impact upon the lives of many individuals and their families. With his goal remaining to improve the healthcare sector, in 2005, Mr. Salem started Proxys LLC, a hospital revenue cycle company designed to eliminate duplicate inefficiencies in healthcare visits and improve care coordination between physicians, hospitals, and other healthcare providers. During the same year, he co-founded Respond Medical, a nursing staffing agency which aided hospitals in Alabama and California. Respond Medical was purchased 3 years later, and Proxys LLC was acquired in 2011. Today, Mr. Salem is Chairman, President, and CEO of ProxsysRx Incorporated, a healthcare solutions company that operates retail pharmacies inside hospitals with a particular emphasis on rural facilities and facilities serving lower socioeconomic populations. ProxsysRx has developed a particular expertise in helping hospitals navigate difficult waters pertaining to federal and state programs while utilizing pharmacies to help accomplish those objectives and positively affect the health outcomes of their patients. He earned his BA in Business Administration from Birmingham Southern College, his MBA from Samford University, and his MPH from the University of Alabama at Birmingham. He has been married to his wife, Melanie, for 47 years and has 3 children. George, we're so proud of everything that you have accomplished. You are a model graduate, and we're so glad that you have taken time out of your busy schedule to share some words of wisdom with us today. Please join me in welcoming Mr. George Salem.
Good evening, and thanks for inviting me. It's a pleasure to be here. I always love talking to students, and you guys have so much to look forward to. So I was asked to share a few experiences of my career, but I want to frame that with what kind of led me in this direction. When I was an undergraduate, I did 2 internships as part of my study. One was with the Cerebral Palsy Foundation, where I actually worked with cerebral palsy patients, and I got to know them very well. And the other was with the Center for Learning Disorders, which at that time was part of UAB. I hope it still exists. I don't know. And there were just things I saw there that really pulled at me. I mean, if you spent a month with, working with people with cerebral palsy who deal with that every day. And then I go back to college, and I go to a fraternity party where people are you know how they act. I'm not even going to get into that. And it just didn't look right, didn't feel right. It wasn't right that everybody was okay, that they were normal, that they could function. And here they were acting like idiots. And I had been one of them. I'm not that good a person. But when I left school, I really felt drawn to do something impactful with my life. I had, my wife and I had been dating, and we wanted to get married, and ultimately did get married, and I'd marry her again. But when I was trying to figure out which direction to go, this school really, it was terrific. I mean, it had everything I wanted. I didn't really think I needed that much more training in business, but I wanted to see the healthcare system from a very different point of view. And I should frame it by saying the last biology course I had was in high school before that. So fortunately, I married a biology major who could explain to me what I was reading. And somebody had to explain to me, now, what's epidemiology again? I had to learn about all that, but it was a great experience. I loved my instructors. Bill Bridgers was the dean then. I was very close to him. Herman Lehman, who just had a room, has a room and some of my money in it, and it just got, I guess, consecrated in the last year. I was very close to him. I got very close to the people that taught me. Some of the finest instructors in the country are right here at UAB. This program is outstanding. It's recognized by everyone. And for those of you that are students, and for the faculty and Dean Erwin, congratulations. For those of you that are students, congratulations to you too. You're embarking on something really great. So my career path started with hospitals. I love hospitals. I've always had an affinity for them. Today they struggle more so than people even realize. I was recently at a conference where it was reported in 2020, 176 hospitals shut their doors for the last time. The best data I could find on 2021 was 73 more went down. So when I started, there were like 8,000 hospitals in America that were functioning and for the most part surviving and doing well. Today, I think that number is closer to 5,200, maybe somewhere in that range. And most of the ones going out of business are in the rural sector, where it's really needed the most. These people need the care. They deserve the same care everybody else gets. And so this company I have today really focuses heavily on smaller hospitals using federal programs where there's additional monies available to them. We've developed a real expertise in doing that, and the hospitals really count on us for it. I don't know if I left it off my resume or not, but after leaving the hospital business, I co-founded a health plan here in Birmingham. It was the first health plan in the state of Alabama called Southeast Health Plan. I really had not planned to do that, but in my role at Methodist Hospitals in Memphis, I had a variety of responsibilities. But one of them also was alternate delivery systems. And I'd gotten very close to a fellow named Richard Burke, who, by the way, is the founder of United Healthcare. And Rich knew of some really key physicians here in Birmingham that wanted to start a health plan. Now, I'm going to, just to give you a sense for what was happening, you're talking about the early 80s when that was going on. Recession was going strong. Healthcare costs were through the roof. Premiums were screaming upward. Does that sound familiar to you, by the way? That's what's happening today. And so there needed to be other solutions than just claims processors, which in my mind, indemnity carriers, really that's what they do. They just process claims. You know, they don't try to manage care. They don't do a lot really for, in my opinion, for ensuring the quality of care. And what you want to do is bring the level up and make sure the appropriate care is there and that it's available to everybody that's in need. But I gave up at a very secure position. I had 2 young children at the time, and we moved here. And from ground zero, we started a company and then started growing. And I loved that company. I loved everything about it. I had wonderful, dedicated young people. And I will tell you, having worked in a hospital and these other businesses I've had, I felt closer to the patient in the health plan than I did in any of the other companies. When we got here and we started, all types of insurance is regulated in every state by the Department of Insurance. But there were no regulations in Alabama. They didn't know what to do with us. And they didn't know who should regulate us. And so the state decided that we should be jointly regulated by the Department of Insurance, which is purely financial. All they are worried about is you not going out of business and covering people. And the Department of Public Health, who were wanting trends. They wanted data from us. They wanted information on disease, all those things. And I was all over that. The problem with that we dealt with is for you young people, you won't appreciate this, but back then, every piece of data you got was very retrospective. You couldn't get real-time information, so by the time you figured out there was more cancer in South Alabama than there was in Central Alabama, it had been happening. And by the way, that was true back then. That was one of the things we couldn't understand is why we could see a higher incidences of cancers the further south you went. And I can't tell you to this day why that was happening, but in my heart I believe that there was toxic waste being dumped into the bay and other places that were affecting that. But that's the kind of information everybody wanted. And I learned a lot of lessons about people back then too. So people, one of the hard lessons is that people don't always want what's best for them. They just kind of want what they want, right? And so I'll give you a couple of good examples. I mean, we had an employer, an industrial employer that it was blue collar company, successful company, but they had a cafeteria, and they also had a terrible health status. Their employees were just not taking care of themselves, and so we had a PhD nutritionist on staff, and we reworked their menu for their lunch cafeteria. And so a month later, the CEO called me up and he said, "Congratulations, George. Our cafeteria is losing money for the first time in 20 years. They won't eat your food. They're bringing in bags of fried chicken." And I said, "Oh, God." And so we tried, but then there were other situations. I mean, one thing we did that I was always so proud of was we took the time to meet with families, and some of them were heartbreaking. I can remember a young family. The dad worked 2 jobs. The mother was working also. That this father, he was blue collar, laborer, and he worked himself out of bankruptcy. The reason he'd been in bankruptcy was that his 10-year-old daughter had a heart defect, and he just couldn't pay for it. And now she needed another heart. She just needed a transplant. And so the CEO called me up and he said, "George, they're beyond their lifetime maximum." Back then, policies had lifetime maximums that you could pay. They probably still do. I'm out of that realm of the world now. But anyway, he said, the company's just gonna kick in $50,000. And I said, our company will do the same. And I'll go to UAB and see if I can get us a better, this sounds terrible, a better deal on a heart. It sounds callous to say that. But I met with Jim Moon and Jim Lee, Jim Moon was the CEO and Jim Lee the finance officer. And we were doing a lot of business with the university then. And they, sure enough, they did what they could. And I said, I'll see about raising the money for the rest. And I called every agency I could think of. I mean, I got people in Washington. At the time, I was on a national board called AMCRO, which was American Managed Care Review Association. This was a board made up to represent all the health plans in America. Listening to the differences in California versus Oregon versus Alabama, it was just unbelievable the things going on. And the whole idea was to create protocols, standards of care, where we could learn from one another and then pass that on in our own communities. Couldn't get any money for this little girl. I got the same answer everywhere I called, and it was me pulling every string I could think of. It was always the same thing. "George, do you realize how many calls like this we get every day? Why should this girl be any different?" And to this day, I'll never get over it. She had the surgery and she died. And the family went into bankruptcy again. We just couldn't help them. But that's what we did. We took the time to meet with families and try to understand their needs. And there were times where we had to make exceptions, and there were times where we didn't. I had one church minister come in with his deacon and told me if we didn't pay for his wife's jaw surgery, I'm going straight to hell. So, I mean, seriously, I'm not dead yet, so I don't know where I'm going, but we'll find out. But some of them were really heart-pulling, and you can see it's been over 30 years, and I still can't get over this little girl. But we did what we could, and that's what we do is all about. Public health, it can be meaningful and can be impactful in different ways. The path you choose is really up to you. You just have to be strong enough to stay committed to it. And it's not easy. If you think about it, I mean, COVID has certainly highlighted the value and the importance of public health. But public health officials in general are quiet heroes. You don't hear much about them. They don't really seek attention. They're just like the FDA. They're doing things for you on your behalf, and you never really know it's happening. It's just happening. They're keeping disease under control, giving injections. When if we had one fall, I remember we had two strains of flu virus come through. 2 strains, very unusual, just swept through central Alabama. And we couldn't, and by the way, if you're running a health plan, that's another couple of $1 million of expense. I mean, it could be very costly, but we reported all that and to the Department of Public Health, and we stayed in those days, Carol Samuelson was the public health officer for Jefferson County. She was terrific, one of my friends. And we did our best to when we saw trends or things of that sort, we try to report those to make sure everybody knew what we were seeing in the data that we were getting, because we had direct access to it. In the end, the people that make it all happen were our employees, and we had a certain I guess we had a certain culture about us. We couldn't do everything for everybody. We tried, but you can't. The thing that people have to realize is that there's a finite amount of money out there. It's not an infinite amount of money, okay? And so you've got this pie of healthcare dollars, and you've got to figure out how that pie gets divided up. The health plan actually got the smallest piece. We would get 8% to cover our costs. That was it. Everything else went to the various providers. What COVID showed me or reminded me is what I already knew, and that is when people think about, the public thinks about healthcare, they think doctors, hospitals, pharmacies, therapists. That's what they think. But the management and movement of information and the massive amount of information you collect, and then how you have to protect it because it's patient information, is enormous. And the metrics is what matters. The metrics are what the most key decisions are made on, are metrics. How you measure things. Most hospitals, when they make decisions today, they don't make them without the finance officer signing off. It is metrics. It's the data that shows. You can't, the dollars are too scarce and too tight. And I think we're making some strides. I don't, in my heart of hearts, I don't believe that the insurance world, I think it's regressed more than progressed. I don't like, for example, I don't mind giving you an opinion. I do not like healthcare deductibles. I think they're the absolute wrong way to go about trying to lower healthcare costs, because if you've got $10,000 deductibles, which a lot of plans do today, what are people who are living paycheck to paycheck going to do? There's a good likelihood they're not going to get that prescription filled because they can't afford it. And prescriptions, by the way, have gotten very expensive. Or they may not go to the doctor when they need to. So what happens? They finally go when it's so bad they've got to go. And you know what? That cancer that could have been caught earlier spreads. And so the bet we made when I was running that health plan was we didn't have any deductibles. We had if it was a wellness visit for a physical mammogram or something of that sort, we wanted patients going. We were willing to pay for that, and then we'll take that gamble. I mean, you're not going to prevent all serious illness, but we wanted people healthy. So I know I'm on a time frame, but just 1 or 2 more stories I think you'll find fascinating. So we got up to about 600 employees, and before our company was acquired, and it was interesting. We also covered state of Alabama prison inmates. I had employees in the prisons. You talk about something scary, but we had trouble controlling our own employees' healthcare costs. I mean, healthcare workers are the worst utilizers of healthcare on the planet. I mean, they know everything that can go wrong with your body, and if you're training in healthcare, at some point you're going to think you have every illness you just read about, and it's accessible to them. But so we decided we were going to practice what we preach. So we started a program where we had a fitness company come in and evaluate every employee that agreed to participate in this healthcare improvement program. And we discovered some young people that had illnesses they didn't know they had, high blood pressure and other things. And then they would create a plan for that employee on the honor code that they had to do every week. Every week they had to initial that they did what they were supposed to do. And I was willing to give them time off during the day to walk or whatever was needed, not an infinite amount of time off, but time off. And we were encouraging it. And I told them, I said, we're gonna look at our claims data on our own people. And at the end of the year, we're gonna measure only illness. We're not gonna count expenses related to wellness, keeping you healthy. I want you healthy, I want you eating better, I want you exercising, and I want you working hard. So everybody, these people would come in with tennis shoes. They kept them at their desks. You know what? Our sick days dropped through the floor. I've left out one key ingredient. I told them, I said, if pure illness goes down, the company will write you a check for your share of that, one third of the illness reduction. So I'm going to pay you to be healthy. That's basically what I'm doing. And so at the end of the year, it was amazing. I mean, the news channels were doing stories on us. We got voted best place to work in Birmingham, which was kind of funny. And the employees believed we cared about them, because we did care about them. We wanted them to do better, and they did a great job. And the next year, you know what? Our illness came down even more. You know, I wanted them healthy. They were working hard. They believed in the company. I had really happy employees. And I mean, if you think about it, we had a lot of claims processors. So what's a claim processor do all day? They're sitting at a desk with, in those days, the computer screens were not like this. They were these big, and it had green letters, and those things went like this all the time. You'd lose your mind looking at them, you know. So they needed a break. They needed to get outside and do something. But the point of the matter is, we incentivized them to do well. We didn't punish them. And we wanted them doing better. And when I look at some of the things happening in healthcare today, it seems like, you know, first of all, I think pure managed care has gone the wrong direction, in my opinion. It's just not what it was, but companies like mine just got gobbled up, and the big players, and then, you know, especially the public companies, it's all about next quarter's earnings, right? So, but I think that we are in this country at an inflection point. I really believe that, and I think that something's got to give. We can't have hospitals continuing to go out of business. Too many communities need those facilities. Imagine the added strain to public health entities, public health organizations, when there's no hospital in town. And when there's no hospital, there's fewer doctors. And they, you know, what do those people do when they walk, when they need the care? I've seen some really cool critical access facilities. I don't know how many of you know what those are. They're subsidized by Medicare. They're basically, it can be 5 beds in a state-of-the-art emergency room and a helipad for stabilization. And those are pretty neat. I haven't seen many of them, but the ones I've seen have been pretty cool. I hope Medicare keeps subsidizing them, because they won't make it without that. But we are at a point, and for you students coming through, you have to decide how you impact our healthcare system, because you're the future. You know, old relics like me, I'm going to go away before too long. If my wife has anything to do with it, I definitely will. But you know, you guys can be creative and find ways to make your mark on this country's healthcare system, because it needs creativity, it needs help. Every company I've had we've had a specific purpose. It took us thinking out of the box and doing things differently so that we could positively impact the healthcare and the well-being of individuals and of hospitals. You know, I have an affinity for hospitals. I love what they do, and I will always appreciate what they do. Everybody's not going to be able to be a university medical center and have those kind of resources. This country needs them, And we need to do a better job making sure people that are in need get the care they need. And you're going to be a part of that. It's your call. You're going to get all the training you need right here in this school. It's fantastic training. But the motivation and your desire, that's on you. No school, I don't care where you go, this one, Harvard, Yale, anywhere, it doesn't matter. It's still going to always come back to you and you as an individual. So what do you want to do with your life? Thanks for having me. I appreciate it. Sorry, I got a little bit emotional, that little girl. I shouldn't have met with her parents. So let's say our Declaration of Commitment to Public Health. And I think I'm leading you. I believe it's on the back of the card, right? Ready? Okay. We, the incoming students of the UAB Public Health, hold sacred our duty to safeguard the community, affirm our beliefs as we embark together during our journey and our training. We'll dedicate our time
and talents to the preservation of health and wellness through scholarship, education, and service. By declaring our beliefs, we affirm our commitment as students, as advocates, and as citizens to work in partnership with the women, men, and children of our community in order to protect the common health, the common rights, and the common good. We believe that every member of our community is valuable. We believe that every member of our community should have access to health care, health education, and preventive services. We believe that as students of public health, we bear a duty to protect our community from suffering, and therefore today we begin the training necessary to provide that protection. We believe that our efforts can only succeed if they are undertaken in partnership with those whom we endeavor to serve. We believe in innovation and embracing change. We believe in forging alliances and consensus. We believe that the scope of our efforts cannot be restricted by time or geography. And we believe that the obligations to which we pledge ourselves today will endure long after we have finished our training. It is upon these beliefs that we undertake our education, understanding that we work not only to better ourselves, but for the betterment of the communities we serve. We are students of the UAB School of Public Health.
Wonderful. Thank you all. Appreciate speaking to you. It's been great.
As we close, I want to again express my appreciation to the School of Public Health staff who have planned and volunteered their time and energy to make tonight's induction ceremony a success. So I've been thinking about our collective efforts to combat, survive, and overcome and look in the rearview mirror to see the COVID pandemic, all as equivalent to the public health moonshot. In 1962, when announcing the goal of landing human beings on the moon and returning them safely to the United States, President John F. Kennedy said, "We choose to go to the moon in this decade and do the other things not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win." So in the School of Public Health, we ask you to choose to matter, to be somebody, to make a difference, and become a part of this new moonshot. I look forward to traveling with you. Thank you again for being with us tonight.